Hello everybody, how are you doing today? Thank you for coming to this conversation about this very important disease with a very fast capacity of dissemination. But before doing that, I want to say thank you not only to all of you for coming this morning to Florida Gateway College and attend our presentation or our conversation about this very important and fast disseminating disease. But also I want to appreciate and I want to say thank you to the Columbia County Department of Health in the presence of Mr. Tom Muffness. And also the presence of Mr. Megan Gunky. From the Bureau of Epidemiology of the state, the Health Department of the state of Florida. And for sure, my colleagues, Doris Lombo and Dr. Gabriel Pardo, for them to help us with this very complex preparation of our presentation. But there is a special thanks not only for my administrators, but also to Mr. Megan Gunky, who have been doing a lot of efforts for us to make it possible. Well, let's begin. Well, when we are talking about measles, look at this beautiful view of Florida Gateway College. We have to go a little bit to the history of measles. Remember that measles is a disease that had been described since a long time ago. If the first description was in the 9th century. In 1757 was described by Dr. Francis Holm as a disease caused by what he considered as produced by an infectious agent. But in 1912 became a nationally notifiable disease. Look how important and how fast the dissemination was. But in 1962 to 1963, the first vaccine became available. So actually, I'm sure that some people, I'm included in the list, will receive the first vaccines that were produced in 1962 actually. Well, initially this vaccine had a name, was called Edmonston-Anders, that was formerly called Moratian. But I want you to observe something very important from this slide. In the year 2000, this disease in the United States was declared as totally eliminated. What is going on with our health? Well, we are talking about viruses and virus transmitted diseases, but what is a virus? Well, I already mentioned that it's an infective agent. Conformed by what? Conformed by either RNA or ribonucleic acid or deoxyribonucleic acid. And this goes to, I know that here in the audience we have students, and I need to refresh where the DNA is placed and what is the RNA or ribonucleic acid. DNA is a molecule that is inside of the nucleus and it has the blueprint of the genetic information of the cell. But there are some infectious agents, like is the case of the viruses, that can contain either or can be made of either RNA or DNA. And that is why it's so difficult for the human body to control them, because they need to be inserted into the cells for them to reproduce. Well, in summary, they need a host, they need a cell for them to be reproduced. Let's jump to measles. Well, measles, I'm insisting, I have the students here in the audience, so I have to mention how measles virus is classified. It's called single-stranded. What is the meaning of single-stranded? Instead of having the two strands of the DNA, it has only one. Negative sense means that we'll be using the information from the DNA of the host for him to be reproduced. Enveloped, protected by a couple of layers of proteins that help the virus not only to be protected against possible agents of defense, but also for him to be invading other cells. And belongs to the family Paramyxovididae. Okay, but why I'm talking about this very complicated amount of names and denominations? For one simple reason. Please observe this slide. In this slide, what I'm pretending to show you is that we have two subfamilies of the family that I initially described. So, okay, but I want you to observe something. On your right side, so you can observe that there is a word, human respiratory syncytial virus. Respiratory, okay. And on the left, you can observe that has the same word is close to it. So, and what I'm trying, para-influenza, influenza sounds familiar to all of you, I'm sure. Okay, but what I'm trying to tell you is that the most complicated thing from this virus is that, as Dr. Lombo and Dr. Pardo will be describing, this virus has the capacity of producing signs and symptoms similar to the two subfamilies. Well, I'm going to show you a lot of graphics that will be very impressive they were impressive for me, and I'm sure that will be impressive for you. And I will be passing those graphics in a very fast way. So just for you to observe how fast the dissemination of the disease had been in a very fast or very short period of time. 2014 was the last outbreak, and observe how in 2019, I'm talking about April the 4th, we had reported around 450 cases. But let me jump to another one that was on April 26th. Observe how we surpassed the outbreak from 2014. Well, right here we have more than 700 cases reported. Hey, these are reported, but what happens to the ones who are unreported? Well, I'm insisting on this slide. Year 2000, totally eliminated. Year 2004, 37 cases. What is going on since 2014 and on? 644 cases, and let me tell you now, more than 1,000 cases. If I project this to the map of the United States, observe the initial maps and observe the areas that were compromised. Look how fast I'm running. Observe this one of the last reports of the dissemination, the states compromised with the disease. Not only the West Coast, but central, right here we have central states, and now we have the East Coast, North and South compromised. Observe here. Look how dramatic is the change of the amount of the presence of the cases all over the United States. Well, the last data I have was from June the 6th, more than 1,000 cases. Well, how is possible for a person to get the measles? The first important thing you need to know is that measles will be transmitted by every single one of the human secretions. So beginning with what? With saliva. And Dr. Lombo and Dr. Pardo will be talking about the population at risk. And why college students? Guess. Why people who work in hospital? Guess again. Well, how is the possibility of being contaminated by this disease? Well, the person who is already contaminated can become contagious from the 4th day before the rash, which is a sign of mechanisms of defense, until 4 days after the presence of it. And I'm talking about the period of time that can range in between 1 to 2 weeks. Well, and how long is the whole process of the disease? Well, can last for several weeks. It depends on the mechanisms of defense of the person. The symptoms will have a period of prodrome that can vary in between 2 to 4 to 5 days, and then the initial symptoms, as Dr. Pardo will be describing a little bit later, so we'll begin from the day 7 to the day 14th, after someone is exposed to the virus. Well, and now I have the pleasure of inviting Dr. Pardo to continue the presentation. Dr. Pardo is a medical doctor and has been with us for a long time as well. I think more than 20 years, isn't it? No, I'm just excited. Thank you, Dr. Pardo.
Good morning, everyone. Thank you for coming. I am going to continue the presentation about measles. And really, it's one important viral infection, highly contagious viral infection that normally attack our respiratory system. This is why it's an infection. The symptoms and the sign beginning between 7 days to 14 days after the contact with this virus. This virus survives many hours after the contact and enter and stay in our mucosa, in our oral cavity, and in our pharynx. The first symptom is high fever between 100 to 104 degrees. And this infection normally, we can confuse, we can compare this infection to another are similar. This is why in in the first times, we don't understand what happened with this fever. Another symptoms in the same time are cough, coryza, and conjunctivitis. You observe all three beginning in C: coryza, cough, and conjunctivitis. This is now the mnemotechnia that the people are using to identify, yes, this disease. And it's important for every nursing, every people that work, for example, in emergency room, me, that I worked many years, it's important to recognize these symptoms that clarify the situation. Yes? It's inflammation in the conjunctiva, one important membrane in our eyes, produce red color, and sometimes produce water secretion, water discharge. After 2-3 days, after appear these symptoms, continue with the Koplik spot in our cavity, oral cavity, and continue with the rash. The rash beginning under the airline or the forehead, continue with the face. After that, in the trunk, arms or upper limbs, and continue with the abdominal wall and the lower limbs. In this slide, we can observe perfect the Koplik spots in the oral cavity. Here, the Koplik spot, very close to the inferior second and third molar. The rash in these patients, in all face, or this slide, look, the rash is very clear in the face, and continue with the trunk. Yes. In the back, lower limbs. Or in this patient, we can observe perfect the rash in the back or in the thoracic abdomen anterior region. Now, complication. The measles is one important viral infection that produce complication, where the first, of course, attack the respiratory system. This is why the best complication, or the more frequently complication, 30%, that is a hard statistic, is pneumonia. Another complication can be ear infection, diarrhea, or one crazy or big problem in the patient's encephalitis. In this case, this patient can lead to convulsions or mental disability. During pregnancy, some women acquire this disease. The problem is for the baby, that can be the premature birth, or the delivery is early, or the baby birth with low weight. This long-term complication, the name subacute sclerosing panencephalitis, sometimes occur because the virus produces that this protein, the protein M, is lack, and the virus stays long time in the body, yes, and produce problem in our central nervous system. In this slide, in this X-rays, we can observe here the pneumonia. Here we can observe the ear infection with secretion, or everyone knows with the name the pus. And here, in this slide, we can see perfect one MRIs. This is a one coronal planes, and we can observe that the virus affect here the brain. This is the encephalitis, is inflammation the our brain.
Good morning. As you can see previously, we have a group of boys and girls that are looking, smiling. That's what we want in our community. Have everybody happy and prevent the complications that we will have with this viral disease, measles. What group it is at risk during an outbreak of measles? Then we're going to recognize babies or infants, women that are pregnant. Also, we have at risk population with poor nutrition or certain type of treatments that make them weak, then those are at risk. College students, why? Because we are in the same room for a period of time that can easily just spread viral diseases and other type of disease as well. People working in medical facilities, dealing with patients that are sick, that's a risk a group of population, as well as international travelers. Then it is important to keep in mind that all of these are part of the risk group, just to be familiar with some of these. How do we do the diagnosis of this disease? Just basically, everybody will notice the symptoms, and you are able to tell that you feel sick, you feel fever, or any of the symptoms described before. Also, clearly taking the blood sample, we're going to see immunoglobulin or antibodies, which are the first response from the body in order to protect our body from invaders. We're going to have immunoglobulins. M, it is the first one to appear and be increased when the rash, it is just onset. Also, we're going to have the viral isolation. We can show up the virus, and that will be done basically with certain techniques. Probably Dr. Megan Gunky can talk about the way they describe the taking of the sample, which is guided by the World Health Organization. Those vaccination programs are not like all of a sudden we decided to do vaccines. It is since long time ago that we have established rules and regulations for vaccines, which are going to protect the community and prevent infections. And not only that, we're going to protect the fact that we're going to have hospitalizations and other type of problems, including deaths of people. We haven't seen really a clear outbreak, and that's why probably there is the thinking of saying, no, I don't want a vaccine. Then the samples should be taken with tubes without additives, and we need 1 millimeter of blood to recognize the virus. On the left-hand side of the screen, you can see the isolation of the virus, and on the right-hand side of the screen, you can see a big giant cell multinucleated in cases of pneumonia, which is one of the complications. That sounds weird, but we don't want to face those type of complications. Now, in the lab, we're going to see the lab count, the white blood cell count, increase because white blood cells are going to protect you from getting an infection. We're going to see increase in leukocytes and also increase in lymphocytes. That could be seen basically in cases of encephalitis, which is one of the most serious complications of measles. Now, let's see what happens with the vaccine. The vaccine, it is chemically treated, the virus, in where it is not capable of transmitting the infection. It is a weak, harmless virus that it is injected to promote the production of protection. It's not going to cause the disease. It's basically going to influence the presence of protection. Then build up defenses. It is the main job of the vaccine. I also want to answer certain questions, and I guarantee it won't overload the immune system, a vaccine. and increase the risk of other infections. It will not increase the risk of other infections. At times we fear those type of things. And neither is gonna cause any autoimmune disease. Then, up to date, there is no proof of causing autoimmune disease by vaccines. How do we prevent the measles spread with the vaccine? It is a live attenuated or weakened virus that the efficacy, it will be 93% with the first doses and 97% with the second dose. Let me tell you, those numbers can be a little bit different depending on the sources that you look at, but pretty much it is more than 90% the protection against the disease, which is an important thing, because without the vaccine, I'm gonna show you soon how it will be the case. Also, it is important in women that are not pregnant. And more important, it is if you are in contact with the vaccine, with the virus, you have been in contact with somebody sick, you can get the vaccine in the 72-hour period, you can get the protection from the vaccine. That's an important thing that is not happening in all type of vaccines. That's a particular case of the measles vaccine. Yes.
This is a two-part question. Is the measles vaccine similar to the pneumonia vaccine? Like, is it similar as far as how you get it, the amount of the weak infection or that is given to you? Is it similar to the pneumonia vaccination?
Okay. Your question it is that if the vaccine it is similar to the pneumonia vaccine.
Yes, like the amount of the infection that you're getting, like through the shot, is it similar to how they treat you, give you the shot to prevent you from getting pneumonia?
The vaccine, it is just a weak virus that will not cause an infection.
Okay, and
Now, pneumonia that you listened before, it is a complication of the disease. Let's understand this. If somebody is sick with measles, is going to have all the symptoms of fever, runny nose, coryza, conjunctivitis, the rash that was shown. And one of the complications, it means instead of being only measles, it became pneumonia, which is an infection in the lung.
yes, but what I'm saying, like you can get the shot for pneumonia to keep you from getting.
For the pneumonia,
Yes, like you can get a shot.
shot for the pneumonia.
Talking about the pneumonia vaccination to prevent pneumonia like older people would get or
Yeah,
people are
like they
pregnant.
offer it at high school as well.
Those are other type of vaccines, and you can get other type of vaccines normally without interfere with one another. Then if people need the vaccine of pneumonia, it's okay. But this is for measles, and pneumonia can be a complication of measles. Then you can have different type of vaccines without any problem. There is no problem related. In fact, there are several vaccines that are offered for kids and a different group of population depending on the conditions. Correct. And you said that you have another part of your question?
And it is proven for a fact that you will not get the measles through this vaccination. It's actual fact, or it has not been proven yet. Because I do know you can sometimes get pneumonia after you get the shot.
Okay. You're ahead of time. I'm just going into that topic immediately. And I know there are so many fears and questions about this type of disease, and we're here to clarify all those type of things because that's what it is important. That's what we are here for. Now, the immunity that we have with the vaccine, it will last for your life period. In fact, I can tell you that my immune system, it is really strong because I work more than 20 years, a little bit old, in a healthcare environment. I work in a public hospital for many years, then it was involved in seeing patients constantly, which that builds up my immune system strong enough to fight a lot of infections. Otherwise, you will be sick and die working in a hospital. Then, if you are really, that's why healthcare field workers are exposed, and then it is important for them to have the vaccine. Yes.
As like a nurse or a doctor, are you required to get vaccinated, or is that not a requirement to work in a hospital?
It is not a requirement, depending on the facilities. Probably, I read, it is not a law by a state, but it is recommended just to prevent you from getting a really bad infection. Probably you can get the position without having a vaccines. However, we were talking about before, while we were doing the presentation, we talk about we are immigrants, and whenever you come to the States, you have to have proof of having all the vaccines apply, because as you have seen, the risk factor of international travelers to bring infections and all the paperwork for immigration, one of the first requirements, it is to have all your vaccinations up to date, even though it is not a law, you are required to. Then it is good to know, and it is important to educate our healthcare students, just because it is your protection. Then let's talk about the vaccine. MMR vaccine, which is mumps, measles, and rubella vaccine, it will be given to children, the first dose at the between 12 to 15 months of age. Then the second dose will be given between 4 to 6 years. Or we can give the second dose 4 weeks after the first one. Now, individual cases are going to be solved individually. Pretty much this is the way the vaccine can be administered or given. Now, here you come with your question. Then, do vaccinations cause the disease that they are designed to prevent? Yes, they do. That's why we use vaccines. They do not cause, I'm sorry, I said yes. They do not cause the vaccine that they are going to set to be protected. They cause mild symptoms, and in less than 5%, they cause those mild symptoms. And almost never they cause the full disease. Now, I received this information from one of my students, and I thought it was extremely interesting for you to see it. Let's look at this. You can observe on your own, and you can have your own answers, because what we want it is everybody to know and take their own decisions and be able to just tell others how important is this. You can see on the left side of the screen, lower percentage of vaccination. On the right side of the screen, higher percentage of vaccination. And let's look at this. Look how amazing this will be. How the virus, it is spread over the lower percentage. And look, the protection from the vaccine is showing by itself. Then over 95%, you barely see something over here. Then that's important to be aware. It really protects you against an infection. The treatment, we're gonna give a treatment based on symptoms. Then we're gonna give fluids and humidifiers. Vitamin A supplements, it is recommended by the World Health Organization just to protect your eyes. Somebody asked about conjunctivitis, and that's one of the main reasons, because the virus will affect the conjunctiva, and it is extremely unpleasant to have something in your eyes. that the World Health Organization recommends the supplement of vitamin A, as well as other medications as needed. You can see acetaminophen and antibiotics based on the individual needs. Can vaccines be given together, different vaccines? Yes. As required or as needed, we can have different vaccines given together, like the MMR that I mentioned, for measles, mumps, and rubella, and varicella, and you can read all over, just they can be given together as needed or as indicated. Now we got to the point of the most important part of this presentation, which is the possibility of the risk of autism. I think all of you have heard about this gossip about autism and vaccines. Yes. You said you have a question?
No.
Okay, I'm sorry. Vaccination has been proven to be safe. The World Health Organization, the CDC, and other institutions are there, and they work every day hard to protect the population worldwide from preventable disease. There is not a link to developmental disorders of vaccines. Also, it was confirmed by a federal law, and you can see all the institutions that are named there to tell you the American Medical Association is one of them. Then all of those are related to the confirmation by a federal court. Now, unfortunately, we don't know the origin of the false report linking vaccination with autism. And the problem it is that now a lot of people, it is without vaccines, and that it is a really serious risk of getting infections. Because when you are not, I have seen mothers that said, I don't want my baby to be vaccinated. The problem it is, you can have your baby at risk, but you are placing at risk, a higher risk, all the others that are going to the same care facilities, to the same daycare, or to the same school. That's a serious problem for the others. And as you can see, unfortunately, there is people related to that. Yes?
So, when you study herd immunity, and because it's always been very confusing to me as a mom trying to research for my own children, when you study herd immunity and you see that initially the whole phrase was coined because they were looking at these civilizations of people who were contracting these diseases wildly. There were no vaccines back then. And so what they were noticing was that when a certain percentage of people had wild measles or whatever, then a certain percentage would be protected. So I guess my question is, how do we ever achieve that with vaccines? Because in most areas in the United States, we have close to 100% of our people that are being vaccinated. But when you cannot guarantee efficacy, when you can't guarantee these things from a vaccine, you're getting, we started with 1 dose, and now at MMR we have 2 doses, and now we've got 3 doses, and then sometimes you go back in and your child doesn't have any titers, and so they say, well, maybe you need another dose. How do we ever achieve herd immunity when we're trying to, people are trying to convince me as a parent, you need to vaccinate your kids because of herd immunity. Well, I don't understand how that works, because most of us as adults are walking around without a gazillion booster shots. So how do we achieve herd immunity? Even if we have 100%, if the whole entire country vaccinates, how do we achieve herd immunity if vaccines wane, and some of them, for some people, they won't even take the first time? So I guess I just want an explanation, how do we achieve that realistically?
How do we have, the question it is, how do we have the the achievable of 100% coverture against the virus. Is that your
Well,
question?
through herd immunity, right, because that's what we hear so much, herd immunity, so how do we achieve that?
Okay. We are not going to have 100%. We're going to have a higher percentage of protection against the infection. We cannot, and there is no guarantee in medicine. There is nothing that we can guarantee. We are going to try to protect as much as possible. And the World Health Organization has these guidelines to do the vaccines in order to protect as much as possible. Now, once you have what the vaccine it is doing, basically, it is a weak virus that it is chemically treated. It is not with infective power. It's not going to cause the disease, but gets to know the virus, and the body itself builds up antibodies, which are the defense against the virus. That's what the goal of the vaccine it is, the protection. That's how it's built up, that 97% with the second dose. And basically having as much as population being vaccinated, we were able to see the description of Dr. Guzman where in 2000 the measles was declared absent in the U.S. territory.
What year was that?
2000.
Okay, I think I read somewhere there that year there were still close to 90 cases. So, I guess the number was low enough that they considered it gone, even though we still had.
You can see variations in numbers, but basically the more vaccine, the population it is vaccinated, the higher rates of vaccination decreases dramatically. And now we have seen an outbreak. That's why we are just trying to explain the importance of being vaccinated.
Sure, and what about the people who received the MMR who are now contagious to other people? Like, how do we keep that contained? How do we vaccinate our kids and keep them, can we keep them contained for a certain amount of time until that, famous shedding period or whatever is over in order to not infect other people? Should there be some kind of law or rule that, 2 or 3 weeks?
The fact it is, when you have the disease, we have to just have not been in school, because that helped to spread the disease. All the human secretions are going to transmit the disease. Then when we talk, the virus is going to be alive for 2 hours in the air, up in the air. Then you can get that virus from the air, from somebody coughing. Then we try to do as much as possible the measurements to prevent the spread of the disease. At times you see not the fact that you cover your face when you are coughing, it is one important thing as well. Not shaking hands, it is another thing that we can, it is just little by little that we try to, that's why healthcare workers are at risk and have to be careful about those areas, and handling secretions in patients, it is difficult. Yes, ma'am.
If you have any chronic or hereditary diseases and you catch the measles, does that affect your terminal or chronic or hereditary illness that you already have? And if so, if you take the vaccination to prevent you from getting the full-blown measles or helping your body fight it, does that also affect your illness that you currently have, such as lupus or cancer or people who have AIDS or HIV? Does that bother you?
She is asking the question about if you have some hereditary disease or immune disease, it will be at risk of having vaccinations. That will be solved case by case. Individually, you have to ask your doctor. And you always are ahead of time, of my questions. Wait a minute, and then you will see your answer over here. But that's excellent. Look, when to call a doctor? I'm gonna tell you, Dr. Guzman,
Dr. Guzman.
I'm gonna call you with my phone. Yes. It is an ancient phone. I don't know if it's related to just over here. Dr. Guzman, now the questions are yours.
Thank you, Dr. Lombo. Thank you, Dr. Pardo, for your excellent presentation. So let's continue with one more portion corresponding to. What happened here? I don't know what I did. I pushed the wrong button. I'm sorry for that. It always happens. It's part of the show, okay? Okay, when you should call the doctor? Well, call the doctor right away if you think that your child has signs and symptoms similar to measles. But what is the issue? The issue, as we mentioned to you before, is that most of the sorry, the viral disease. I don't have measles, okay? Most of the viral diseases that can affect the respiratory tract will have a similar. Let me use this word, a similar beginning. So congestion of the oral cavity, congestion of the conjunctiva. Somebody asked about the conjunctiva. The conjunctiva is a little layer, a tiny layer that covers the outer portion of the eye. I'm sorry. I don't have the cold. All right. So you have to call the doctor if you perfectly know that somebody who is around your child or your family is running on measles. It's a very important thing for you to know. If your child is an infant, you have to even be more careful about it. So I should, yes?
When it comes to infants, do they have the exact same symptoms, or is it worse?
Okay, please remember, I'm sorry, your name is?
Stella.
Mrs. Stella is asking if we have a child, the signs and symptoms will be similar to the symptoms that can occur in adulthood. Well, every single one of the viruses have a certain pattern. And when we are talking about pattern, is the beginning, the signs and symptoms that are at the beginning of the disease, in the middle of the disease, and at the end of the disease. Yes, the answer is yes. The thing is, and I want to clarify this, most of the viruses who are classically affecting the respiratory system will be having in the first week to the half of the second week same signs and symptoms. That's why it's confusing for the mom or the father or the person in charge of the child to realize if that child who might be in touch with somebody contaminated with the measles disease, if that girl, that boy is beginning on or is running on the problem. Well, but there was a portion of did I answer your question, ma'am? Yes. Okay, thank you. So one very important thing for you to know, if you are 100% clear that your child is affected by an autoimmune disease, and remember that for the ones, I have students here, and you have to know that autoimmune diseases are diseases that most of the times are produced by certain cells that are affecting areas of the same body. But in most of the treatments for those diseases will be medicines that will be regulating and will be controlling the response of the immune system. And that's why they are more proclive of having any kind of contamination. Well, there are some other diseases, like is the case of TB. For the ones who are not familiar with the abbreviation tuberculosis, tuberculosis is, we are pleased to know that tuberculosis is a disease that is partially, look at my fingers, partially eradicated. So we still have some cases in certain areas of the United States. But we have to know that it's produced by a bacteria that affects mainly the lungs and can be also disseminated, and the medicines to treat that specific disease will also depress the immune system of the patient. As you may understand, cancer. So cancer is today is considered as a chronic disease, and most of the medicines who are applied to different kind of varieties of cancer will depress as well in the first stage the immune system. Well, As you may observe, we have the source of information, the Health Department of the state of Florida, CDC, and a lot of more of sources for us to try to transmit the most clear and precise information to all of you. We're insisting. So we are trying to make people understand how important is to know about the diseases. So at the very end, the decision of being vaccinated or not is so personal. We don't have regulations. We don't have strict laws that force the mother or the father to take the kids to be vaccinated. Our goal is you to be informed. Our goal is you to know how important is to know about the complications. Not a tradition, and you have to understand that a measles under the age of 5 and after the age of 25 will be even more severe than in the amount of in the population that ranges in between the age of 5 to 25. So that's the way the immune system works. Well, I have the great pleasure now to invite Ms. Megan Gunky. So is from the Bureau of Epidemiology. So thank you for coming, and I appreciate your presence today. Thank you, Megan.
Give me just a second to switch
Sure.
over to my presentation. All right, perfect. Hi, everybody. My name is Megan Gunky. I work for the Florida Department of Health at the state office in the Bureau of Epidemiology, like Dr. Guzman introduced. I have worked for the state. This summer will be 8 years. So I've worked in public health. I started at the county, and then now I work for the state health department. Currently in my current position, I'm a regional, which means that I assist 18 counties in the Panhandle with investigating diseases and handling outbreaks. One of my other duties is actually as case reviewer for measles for the whole state. So I'm what some would call this expert in measles for the state of Florida, and I've been doing that for a few years now. So I want to thank all the other doctors about presenting kind of about the disease. I'm going to go from the perspective of the health department and what we do when we're dealing kind of with measles and what we have available to assist in those investigations. So like I said, I'm going to go over a little bit about measles in Florida, reporting requirements, laboratory testing, and then investigations. So this graphic right here is showing over the last 10 years, so 1998 to 2018, the number of measles cases specifically in Florida. You can see we've definitely had, unfortunately, kind of an upward trend, which mimics, obviously, the national numbers that we saw earlier today. Now, specifically last year, which is our last year of complete data, we had 15 cases reported in Florida residents. This mostly was consisted of 11 cases that were actually connected to 2 small outbreaks. The rest were sporadic cases. 6 out of the 15 cases were acquired outside the United States or were acquired by someone else that had traveled and brought it back. The rest were locally acquired, unfortunately. I will say that none of the 15 cases were vaccinated, so that's something to keep in mind. There was an additional 4 cases that was investigated that were not our residents, but were visiting Florida while they were infectious. So you have to realize Florida, touristy state, we get a lot of people coming here, visiting family, going to Disney World, you know, all that fun stuff. The diseases, unfortunately, don't stop at the border. So, you know, if they come here and they're sick, and it's something of public health concern, we're going to be following up and we're going to be hopefully preventing further spread of that disease. So, you know, yes, we have the 15 cases, but we're going to be looking at those others as well. Now, 2019, I pulled this graphic actually from our vaccine preventable disease report. So far this year, we've only had 2 cases, which compared to last year, obviously is a lot less. Both cases were acquired outside of the U.S., and neither of them had documentation of vaccine on board. So we are only halfway through the year, so there definitely can be more, but so far we're only at 2. So we're glad, obviously, but we're working hard. Now, reporting requirements, what is that? So the CDC has a list of what they call nationally notifiable diseases. And this list includes a variety of diseases that they want to know about. In that earlier presentation, you saw CDC numbers of kind of for the whole US. And so every state is required to report to them. Now, each individual state can add on other diseases as they see fit that they feel like is important for that state in addition to the nationally notifiable diseases. And so in the state of Florida, this is our what we call our reportable disease list. So written into Florida statute 64D3, practitioners and laboratorians are required by law to report these diseases. And it's everything from STDs to Lyme disease to salmonella to, of course, measles. Now you can see there's different colors. So the black color is looking at next business day. So if someone diagnosed somebody with something, they need to report within the next business day. The blue is upon diagnosis 24/7. So every county health department as well as the state health department has a 24/7 access line, basically phone line, for reporting of these diseases. And the reason for that is because there's some public health intervention or thing that we need to do, and we need to do it quickly. So we need to know if it's a Saturday night, we need to know about it. Now the red is the highest level, and that's 24/7 upon suspicion. So that doesn't mean you necessarily have a positive test, but you suspect it. And measles is one of those. There's other things like anthrax and different things, but it's basically ones that as soon as you suspect it, we want to know about it because we're going to do some follow-up related to that, and we may need to, do some things no matter what kind of time of day or night it is, unfortunately. So this is a little flyer that we've produced that has gone out to providers. It's just a quick little kind of graphic that helps to determine if you should be suspecting measles. So we kind of have the identify, isolate, inform. So identify. So we've already kind of talked about the symptoms of looking for, the cough, coryza, the conjunctivitis, the rash that starts on the hairline, moves their way down. Also looking at risk factors. Do they have travel internationally to maybe a state that has an outbreak going on? Do they have vaccine on board? Or contact with someone that they know is ill. You want to immediately isolate that person because, again, it's very contagious. And so the less people that are exposed, the better, obviously. And then the next thing would be to call your county health department. We have some lovely representatives in the back, Martin, and they're the ones that you need to call because they're gonna be asking you for information of, the information we just talked about. What are their symptoms? What are their risk factors? They're the boots on the ground investigators of these cases, and so they're going to be the ones that you need to call. Now, once they've been notified, the next step is this really a case, and how do we do that? Laboratory testing. So it was already brought up, obviously, about serology, but there are other options as well. So respiratory and urine can be taken, and we can do PCR, which is polymerase chain reaction. Basically, it's looking for the DNA of the virus in the respiratory specimens or the urine specimens. Unfortunately, it's not available commercially. It's only available at our Bureau of Public Health labs, and it is also available at CDC. It's the preferred specimen because the majority of the population is vaccinated, so it's slightly more accurate. But obviously serum is an option as well, and it is available at most commercial laboratories. Specifically, when I'm saying respiratory specimen, I'm talking about a swab. So, the icky thing where the doctor goes in and sticks it in the back of your throat and it scratches a little bit. And that needs to go in viral transport media. You want to collect the samples as soon as possible after the rash onset, preferably within 3 days. And it can be detected 10 to 14 days after that onset, and we have had cases where we've done that. It needs to be refrigerated, and then we would test it at our state lab. Urine specimens, 10 to 50 ml of urine in a leak-proof container. Again, collecting as soon as possible after rash, and then again, it can be detected up to 10 to 14 days after that onset. Now, serum specimens, we had already talked about that briefly. You want to collect it in tubes without any additives. Typically, they call it a red top or a tiger top tube. I have a picture of one kind of up there. The thing to keep to note with this that up to 20% of tests may have false negatives if collected within 72 hours of rash onset. Hence why it's not exactly the most ideal way to test, and it really should only be used for unimmunized patients with clinically compatible illness, because we can get false results with serology, unfortunately. And then IgG, that typically is used to look for immunity, but we can technically use that to see if there's a rise in that after kind of onset of symptoms, but it begins later than the IgM. The IgM is definitely the more acute, which you already discussed briefly. The thing that I'll say overall about this too, it's not just about accuracy, it's also about timeliness. Testing for serology can often take a few days to get the results back, whereas PCR, if we're running it at our state lab, if Marjorie in the back gets a call about, you know, a measles case and she's talking with us and talking with the lab, you overnight that specimen or even drive it over to the state lab, we can get it done, I would say, I don't want to say 24 hours, but within 48 hours. Typically, it gets there in the morning, the lab techs pull it, we have an answer before the end of the day. And, you know, the reason why that's important is, as we talked about, kind of getting post-exposure prophylaxis and being able to prevent further spread and understanding, you know, what's going on. So measles investigations, why are we concerned with it and what do we do? So if we identify a case, we get a positive at our lab and we know it's a confirmed case, what are we gonna do? We need to create a list of individuals that were exposed to that case. We're looking at household contacts, who's in the house. We're looking at, you know, they obviously probably went to the doctor, so healthcare facilities, you know, school, work, other activities. Do they go to the gym? Do they go to the store? Do they go to a birthday party? Where were they? It was talked about earlier that the infectious period is 4 days before to 4 days after rash onset. So we're looking for that 9-day period. Where have they been? Who have they been in contact with? And we're going to take that group of people and we're going to prioritize follow-up depending upon their immunity status or their risk of severe disease. And so you can see here we have 4 priority areas: that they're not immune and they have a high risk, they're not immune and not at risk, immune status unknown, or considered immune. So how do we assess immunity? So basically we consider you immune if you were born before 1957. What does that mean? Not that you were born in 1957, 1956 and older. Because essentially the disease was so common during that time period that most people got the disease, therefore they have their own natural immunity because of that. Now in terms of actually getting the vaccine, 1 or 2 doses of MMR documented. Healthcare workers must have 2 documented doses. I believe there was a question earlier about requirements. So absolutely, every facility is different on what they require. However, in terms of an investigation, and if we had a case in a hospital facility, if someone doesn't have documented 2-dose or documented immunity, we request that they're pulled from work until they can show that documentation. And so it's just for your safety, patient safety, that sort of thing. So just something to keep in mind. Now you're considered not immune if you've never received any doses of the MMR. Obviously we talked about the infants under age 12 months because they can't get the vaccine, and severely immunocompromised individuals. So immune status unknown, they tend to fall into that if they're not sure, they don't know, we don't have record of it. We can get an IgG titer just to see if they have that level of immunity or not. It's just another way to figure out what's going on. Now, post-exposure prophylaxis. This is really the reason why timely reporting, timely follow-up is so important. So we did that assessment, we found all the people that were exposed, and now we're determining who's at risk. We're taking that risk group, and if there's people that are not immune that can get protected in a timely manner, we're going to recommend that. So if someone that is 12 months or older, so not the babies, that isn't vaccinated, they can get the MMR within 72 hours of initial exposure. That's why that time frame of getting the test results back quickly is important, because 72 hours is going to go very quickly. So we want to make sure that we get that information back as soon as possible. Now, immune globulin. This is another option. This is specifically for those that are under 12 months or who are immunocompromised, or like the pregnant women maybe that don't have evidence of immunity. This has a little bit longer time period, thankfully. It's within 6 days of exposure. And so, again, it's not indicated for anyone that can actually receive the MMR, but it's another option for those that can't. And this is just the different types of IG. So there's IgIV, and then there's IgIM, and there's different individuals that it's more appropriate for, basically. And that decision would be up to their medical provider to determine if they feel like it's necessary or not. That's all I really have. Again, from the health department's perspective, our goal is to stop further spread. And the thing to keep in mind is, we're trying to prevent those secondary cases, and getting that post-exposure prophylaxis in individuals that need it, as well as notifying people that they were exposed, is very important. Now, if we get a secondary case, that whole process starts over again. We're going, okay, where were you in your 9-day period, and finding those contacts and doing the same process again. And so, yeah, I'll take questions. Yes, ma'am.
Just a quick question. Does the state of Florida, or even above, maybe the CDC, do you guys test when those come in to see which strain they are, like if they're a vaccine strain or like a wild strain?
Yes, that's a great question. So the PCR that we do at the state lab does not differentiate between the wild or the vaccine strain. So if it's someone that we suspect is a vaccine-related kind of illness or something like that, we can send it off to CDC and what they refer to as a genotype. So certain genotypes are considered wild types, and then the vaccine has a very specific type. So if that's the typing on it, then that would be from the vaccine technically. So we do work with CDC on that. They also do sequencing that would further identify maybe connections to other cases or other countries. For instance, some of our cases from last year, looked similar to ones from the Ukraine, and then we found out they had Ukraine travel. So, we definitely do further kind of analysis on that, and we do work very closely with CDC regarding that.
Be up to somebody in your facility to say, we think this should go to the CDC to determine where it came from, or is like, what are the steps for that?
Right. So if it's positive, we typically do send to CDC for genotyping. So it's pretty much automatic for that.
Do you have access to those results?
I believe the CDC puts out some information regarding that, as well as WHO, because a lot of it's very interconnected. You have to remember, certain genotypes are more popular in certain places and are connected to outbreaks. So there are places online that does have that level of detail. I'm not sure that we have that available directly through our site, but definitely CDC has that information. Yes, ma'am.
On the concern of vaccination, where is the state of Florida on looking at continuing religious exemptions versus not? Because I know some of the states now no longer have religious exemptions. So do you know where we are in Florida on that?
Sure. Her question was related to religious exemptions. So state of Florida is one of the states that does have those in place. And honestly, I'm not sure. I'm not part of that conversation directly. I deal with kind of more after the disease is here, unfortunately. And so we do have a whole immunization section that deals more with on that side of it, and I am not a part of that. So I'm more on the investigation once the disease, unfortunately, is here, and preventing further spread, obviously. So that's definitely a question I think that's happening throughout the U.S. and will probably continue as we get more and more vaccine-preventable diseases popping up. So, but good question.
Can I have info on that? I'd be happy to speak with you after. I follow that very closely with Tallahassee.
Yes, ma'am.
So you said when you guys receive a positive case, you guys narrow down the people who that specific individual was in contact with. How do you do that? Because you said in the 9-day period, what if somebody doesn't remember where they were specifically in all those 9 days? How do you contact everybody?
So her question was related to the 9-day exposure kind of period, and how do we actually identify contacts? And that's a great question. We talk to the people. We talk to them. We walk back through steps. Honestly, with the 9-day period, a lot of times they're sickly, so they're not technically doing too much most of the time. Sometimes they are, depends on how sick they are. But so hopefully they have some recollection. In terms of working with healthcare facilities, because a lot of them obviously have gone to a healthcare facility, they're usually able to pull a client list of who was there that day, and then we can start notifying them through that route. Again, it's just working closely with them. Sometimes we ask people to go back and look at their credit card receipts. You know, I don't know where I ate, but I can pull up my credit card receipt and find out where I went shopping or where I ate, that sort of thing. So we have different mechanisms to interview and try to get more information from them. We do that for other diseases as well, quite honestly. You know, we're working with the people to jog their memory a little bit, and then we go from there. So, yes, ma'am.
What's the reasoning for the second MMR?
Well, I believe on the slide that was shown earlier, her question was related to the reason for the second MMR. So the first MMR is going to give you 93% effectiveness, and the second one brings it up to about 97%. So getting that second one is going to increase your protection, basically. So we want more protection, and that's why certain vaccines, you know, will have multiple doses. So like Hep A is 2 or Hep B is 3. So depending upon the vaccine, you know, there's been research done essentially that's, you know, showing that that is needed or warranted basically to have a better level of protection to protect you from disease.
Thank you.
I think, oh, yes, ma'am.
When you said that you check up with people if they do come out positive with the disease, and you go and check the people that they were around at that point, what if they were staying with someone who is already ill, like say for instance cancer, and they're taking like radiation and chemotherapy, and they are unable to go to the facilities that y'all would do more vigorous tests to see if they are positive? Do y'all go to them and compensate for that? Like, how does that work if they're unable to go to the facility?
That was a great question. So the question was related to how do we handle maybe people that can't get out to see the doctor or that sort of thing during an investigation. So gotta give a hand to our lovely county health department folks. We have vehicles, we drive. We'll go out and find you. We'll help with whatever we need. If we need to get specimens, or if we just, you know, we've done interviews in person. Sometimes it's better in person to talk to somebody and get information. So we will go out, and that would be an option.
You will
Pretty much.
also give them the shots or whatever they need treatment.
Correct. Whatever is needed, we will work them. If someone's that ill, though, we'd probably want to refer to their physician just to confirm that that's appropriate. Anytime you're dealing with someone that has any sort of medical condition, we are not their provider. We are not their doctor. We can only provide recommendations. So if someone's that ill, you know, we would want to be working in conjunction with their provider to make sure that they felt like that was appropriate for them. Yes. Other questions, comments? Well, I will end it there then. Here's my contact information if you have any questions, and thank you guys. Thank you for having me.
Thank you.
I'm going to widen your question a little bit more. So,
Question or answer?
your answer, I'm sorry. So, I was thinking about the question, I'm sorry for that. So, and with regard to the reason why to receive a second shot for you to be even more protected is directly related to the amount of exposition to the immune system. So the first time you receive the shot, it's like the phase of recognition of the immune system, the acquired immune system, to the germ or the microbe or the virus that is inserted into your body, and the cells of immunity will be mounting an immune response. The more you are exposed, let me describe it this way, the bigger the response of the immune system will be for that specific germ. So that's why during the first shot you get a 93%, and after the second shot you get in between 97 to 98% of protection. The more you are exposed to the disease, the more protection you will get.